Hi guys and welcome back to my channel. Whenever I post some dental related kind of video, I get a lot of comments regarding how does dentistry work and how to get into a college in Tamil Nadu, or how just dentistry works on the whole and how to get past each year. So many things, but I'm going to make this particular video just to give you detail about what exactly is the course BDS and how it works in this video. So let's get started. So the first thing is what I want to tell you guys is I am a third year BDS student, and BDS stands for Bachelor of Dental Surgery. So this course is basically for 5 years, out of which the first 4 years is going to be completely studying, and the last year is going to be internship, or also known as house surgency, where you work in the same college hospital that you actually study. For that I want to tell you guys what exactly dentistry concentrates on. So half the population in the world think that dentistry is only about 32 teeth. So I'm just going to put out the facts right over there that it is not. But we're going to be concentrating on the head and neck region. So basically starting from here till here is what we concentrate and specialize on. So the next thing that I want to tell you guys about is that dentistry has 9 different specialities. There are actually many more micro specialities that are available, but these are the these are the common 9 specialities that dentistry has. And just because I need to go with the flow, I'm going to read it out. So it is going to be periodontics, oral and maxillofacial surgery, periodontics, orthodontics, endodontics and conservative dentistry, prosthodontics and implantology, oral pathology, oral medicine and radiology, and public health dentistry. So let's next go to what you learn every year. So like I said, there are 4 years in which you actually study, and each of these years have about 4 to 5 subjects, which involves about the majority having medical subjects and 1 dental subject for the first 3 years. So the first year you will have anatomy, physiology, biochemistry and oral histology. So basically anatomy is we concentrate on head and neck, but I am affiliated to MGR University, so we ended up having the whole portion, but our main key of focus was head and neck region. Physiology, of course, we studied about the entire body. There was nothing like head and neck region over there, and then it was biochemistry. So the last part is oral histology, where you get to learn about all of the normal tissues of your oral cavity. The exam wise, you will have to write physiology and biochemistry as a single paper, and anatomy as a separate paper, and oral histology as a separate paper. So that's how the marks will be divided. You will basically be writing 3 exams but 4 subjects. The second year consists of pharmacology, general pathology, general microbiology and dental materials. So again over here, pharmacology is a separate exam, like a separate subject and an exam, and dental materials is a separate exam paper, whilst general pathology and general microbiology is a combined paper. So basically you write again 3 exams but 4 subjects. So pharmacology is definitely generalized, but there is also given equal importance to medicines involving in dentistry, but you just learn about everything, and everything is important. The next part is general pathology. You learn about the general pathology you see in tissues. This is not focused only for oral cavity. This is for throughout the body. So you learn even about the pathology of your lung or your liver or your kidney. The third subject is general microbiology, which basically you study about all the organisms getting to dentistry and also just generally in the medical field. Dental materials is the last subject, and this is the dental subject. Materials like restorative materials and materials used for processing and all that. Learn in and out about all the materials that we use in dentistry. Stop with the first and third year because these are non-clinical years. So this, what I just spoke to you about, is just theory, and what you have in the practical side is first year you don't really have much to do with practical oriented in dentistry. You will have practicals for all the other subjects, but there is something that you have to do every year as a non-clinical part, something called as a teeth setting in first year. My college gave us task of doing 1 teeth setting and processing a denture. That's what we did in first year. You will learn the process, but first year this is what you do. In second year you have a quota of finishing, like my college gave us 10 teeth setting to finish, and 4 removable partial dentures to finish. Right now this might sound a lot, but if you are actually in this course, you will understand what it is. Second year you have 4 theory subjects but 6 practicals, extra 2 practicals called as preclinical conservative and preclinical prosthodontics. So preclinical conservative is where you learn how to do cavity preparations in something called as a typhodonty. Is a toy version of an oral cavity where you get to practice, and you can practice doing cavities over there. And for preclinical prosthodontics, you do a complete teeth setting. I will try to put up pictures somewhere over here, just for your reference from what I did. Third year is supposed to be the honeymoon period of dentistry. I don't know. Yeah, I'm in third year. I did kind of enjoy, but the next 6 months I just spent sitting at home because of Corona. Basically, you have 3 subjects in this particular year, which is general medicine, general surgery, and oral pathology. So the fun part about third year is you enter into clinicals. What happens is we have 3 subjects. So I'll just tell about how it works in my college. So in my college we have these 3 subjects as theory, but we have something called as having postings. So postings is where we have for the rest of the day. Morning we have lectures, and postings we have for the rest of the day. So these postings are basically the remaining dental subjects which are there in final. So final year there are totally 8 subjects that you have to write an exam for, both practicals and theory. So these 8 subjects are what we have as postings in third year as well, because you need to finish your third year quota as well to enter into the final year, and all of those quotas are combined together for your final year exam. So in third year we have, except public health dentistry, we have all the other postings. Like all the other specialties I told you, we have all the other posts. General medicine, you learn conditions of the body, systemic diseases and how to treat it, etc. General surgery is the same, but you also give it like a surgical, what is the surgical procedure, the surgical treatment that you do for that. Oral pathology is where you completely talk only about the pathology of the head and neck and the oral tissues. So in third year, you have a set of quota for these postings. Like in every department, you need to see these many patients or write these many cases. Each department will give you a particular set of quota to complete. In final year, again, you have all of the 8 subjects except oral pathology. Oral pathology is a third year subject. Apart from that, you have all the other specialities as a final year subject. So you have 8 theory exams, 8 practical exams, and tons of quota and tons of patient work to do. The types of patients that you actually come across will be varied, like crazily varied. Majority of the people will come to you for tooth pain, yes, that's guaranteed, but there are also other reasons why people come to you, because they notice some kind of discoloration, they notice some kind of swelling or some other kind of sensation which is not really pain. So basically it's not just about tooth that you need to know about the extra oral tissues as well. So basically anything related till the head and neck region, it is your particular community to take care of. So another thing that dentists usually do are perform emergency procedures, and also an oral maxillofacial surgeon generally takes care of trauma cases as well, such as accident cases and burn victims, etc. About the prescription part of prescribing drugs for people, we know to generally prescribe as well, because we learned the subject general pharmacology in second year, and hence we are allowed to prescribe medicines for any kind of general general antibiotics, etc., apart from just a normal dental pain. So another commonly asked question was, what NEET mark do I need to get to enter into any college in Tamil Nadu? I'm very sorry, I don't have the answer for this, because every year it just keeps changing. I was the first NEET batch, like for sure when they said NEET is the one that's taken into account. So my eligibility was different, but the next year the eligibility completely changed, so you just have to look forward to each year. Another common question is, why BDS? Like, why would you want to take BDS? I was an external person. I thought, we just concentrate on 32 teeth. Why should I waste my time studying about 32 teeth for 5 years plus another 3 years for MDS? but when I stepped into this particular course, I understood that there is so much more than just 32 teeth, and I'm telling you, it's definitely not what I thought. The fact about BDS is that why I would say it's very very challenging, because you need to be strong in your theory as well as your practicals. And skills need to be amazing. Okay, at least I'm not amazing, I'm like decently good, just somewhere over there. I'm managing your preclinical quota as well as your exam. Managing your clinical quota as well as your theory exam is a huge headache, and time management is the key. If you don't manage time, it's going to take you on a roller coaster. You come back home after all the work, you'll just be really dead tired and you will not feel like studying. But you have to, if there's an exam the next day, you need to find out various methods in which you can occupy everything and give equal attention to everything. Split this up and talk about time management in a completely different video, because that was also specifically asked. And there were a lot of other questions, such as how I deal with migraine and stress during this college period, etc. All of that will be in other parts of the video. This video is just completely briefing you about how the course BDS works. Yeah, so I hope you found this video informative, and let me know in the comments if I've missed out anything, or if you want me to add further points in my upcoming videos. Yeah, let me know, and I'll see you next time. Bye bye.